Inflammation of ear canal. The inflammation of ear canal are divided into infective group. The infective group may be bacterial due to bacterial pathogen or fungal due to fungal origin and viral due to virus. The infective group is classified into three main categories. That is localized otitis externa. They are also called furuncle. Number 2 is the diffused otitis externa, and number 3 is the malignant otitis externa. The fungal is due to automycosis, and the viral is due to herpes zoster oticus or otitis externa hemorrhagica. The furuncle, also called localized acute otitis externa. The organism for furuncle. Organism. The most commonly organism that cause the furuncle is the staphylococcal infection of the hair follicle. Staphylococcal infection. Staphylococcal infection of hair follicle. As the hair are confined only to the cartilaginous part of the meatus, so the cartilaginous parts of meatus are involved. Cartilaginous part of meatus are usually involved. The involvement of the cartilaginous part of the meatus in the furuncle. The second name of the furuncle is localized acute otitis externa. The organism for the furuncle is the staphylococcal infection of the hair follicle. Usually they are single. The furuncle are usually single, but they may also multiple. The patient usually present with severe pain and tenderness, which are out of proportion to the size of the furuncle. Movements of the pinna are painful. Jaw movements, as in chewing, also cause pain in the ear. There is severe pain in the furuncle. There is severe pain and tenderness, which are out of proportion to the size of the furuncle. Movements of the pinna are painful. Movements of pinna, and also pain during chewing. A furuncle of the posterior meatal wall causes edema of the posterior meatal. Furuncle of the posterior meatal cause edema over the mastoid with obliteration of the retroauricular growth. The lymph node may also enlarge and tender. Lymph node enlargement. The lymph node may be enlarged and tender. So now we discuss the treatment for the furuncle. The treatment for in the early cases of furuncle without abscess formation consists of systemic antibiotic, analgesic, and local heat. Early treatment is the systemic antibiotic, analgesic, that is NSAID, and heat are used in the early cases. An ear pack of 10% of ectamol glycerin provide the splintage and reduce pain. 10% ectamol, they provide splintage and they reduce the pain. Hygroscopic action of glycerin reduces edema. They also reduce edema. They reduce the edema. And in case of the recurrent furuncle, if there is recurrent furuncle, in cases of the recurrent furuncle, there may be diabetes or staphylococcal infection of the skin. Diabetes mellitus. We, in this case, excluded the diabetes in attention paid to the patient nasal vestibule. The recurrent infection occur in the diabetes if the patient put his finger in the nose. There is the spread of the staphylococcal infection. If patient habit of putting his finger in nose, there may be the risk of spread of the staphylococcal infections. Staphylococcal infection of the skin also may be present. This source also be excluded, and the patient is treated for these type of infection. The main infection is due to staphylococcal infection. The recurrent infection mostly caused due to diabetes mellitus, and if the patient has habit of putting his finger in the nose, there is spread of the staphylococcal infection. The second type of infection and inflammation of the ear canal is due to diffuse otitis externa. It is a diffuse inflammation of the meatal skin which may spread to involve the pinna and epidermal layer of the tympanic membrane. Inflammation in the meatal skin and of the tympanic membrane. The disease is commonly seen in hot and humid climate and in swimmer. Commonly seen in hot and humid climate. And also seen in swimmer. Excessive sweating changes the pinna of the excessive sweating changes the pH of the meatal skin from that of the acidic to alkaline. Excessive sweating in the hot climate also changes the pH of the meatal skin from the acidic to alkaline, and the alkaline pH favor the growth of pathogen. They favor the growth of pathogen. The diffuse otitis media causes are two. Number first is due to the trauma to the meatal skin. Due to trauma can result from scratching the ear canal, which with hairpins or matchsticks, and due to the trauma is due to pulling the hair canal with hairpins or matchsticks. Unskilled instrument also cause the trauma, and remove the foreign bodies due to unskilled instruments by unskilled person, or repeatedly cleaning of the ear can also cause trauma to the canal. The other is the pathogen. The second is the pathogenic. The most commonly organism responsible for otitis externa are Staphylococcus aureus. The organism are the Staphylococcus aureus, the Pseudomonas pyocyneus, the Pseudomonas pyocyneus, and bacteria called Bacillus proteus and E. coli. The Bacillus proteus and E. coli can also cause the pathogenic type of diffuse otitis externa. The diffuse otitis media externa or diffuse otitis externa can be divided into two phases on the basis of the chronicity. Number first is the acute phase. Acute phase is characterized by hot burning sensation in the ear. There is hot burning sensation. There is hot burning sensation in the acute phase, followed by pain which are aggravated by the movements of the jaw. The pain aggravated by movements. Pain aggravated by movements of the jaw, and there is also oozing thin serious discharge which becomes thick and purulent. Thick discharge which becomes purulent. And they inflame the meatal linings, and the meatal lining becomes swollen. They inflamed. There is the inflammation of meatal lining. The meatus become swollen. The meatus becomes swollen in this phase, that is acute phase. This give the meatus becomes swollen. This gives rise to the hearing loss. Hearing loss due to the acute diffuse otitis externa, and regional lymph node become enlarged and tender with cellulitis of the surrounding tissue. There is regional lymph node enlargement and cellulitis occur. The hearing loss in acute diffuse otitis externa is conductive. The hearing loss is conductive due to the swelling of the meatal lining. The chronic phase of diffuse otitis externa is characterized by irritations and strong desire to itch. There is irritation and strong desire to itch. This is responsible for acute exacerbation and reinfection. There is acute exacerbation and reinfection. Reinfection occur in the chronic phase of diffuse otitis externa and the patient desire to itch. Discharge is scanty and may dry up from crusts. There is scanty discharge. Whereas in the acute phase there is mucopurulent discharge. Meatal skins become thick and swollen and may show scaling and fissuring. The meatal skin become thick and they show scaling and fissuring. Rarely the skin become hypertrophic. The skin may become hypertrophic, and this hypertrophic skins of the meatus lead into meatal stenosis. They may lead to meatal stenosis, and this meatal stenosis is also called chronic stenotic otitis externa due to the hypertrophic of the meatus. This is also called chronic stenotic otitis externa. Chronic stenotic otitis externa. In this case of the diffuse otitis externa, the chronic stenotic otitis externa, the excisions of the bony meatus can be done by drill, and skin graft can be attached, and excision of the bony meatus by drill.